a new perspective on the NextGen Patient Portal. My name is Chelsea Grover, and I'm the Marketing Communications Manager for Attentive. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. We'll be sending out a copy of these slides and recording within the next week. Next, for those of you who aren't familiar with Attentive, I want to share a bit of who we are with you. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen, and we also have two add-on productivity solutions for NextGen, ChartGuard and Refund Manager. Next, I wanted to mention an upcoming webinar, Making NextGen More Efficient, Tips, Tricks, and Tools Created by the Nexperts. Join us on April 25th as we showcase some of the reports, programs, scripts, and development that we have created to help with the day-to-day efficiencies and which may help to benefit your practice as well. I'll be sending out an invitation for that next week, or you can sign up now on the Events and Education page of our website. Okay, so back to today's webinar on the patient portal. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Cindy Kincaid is Vice President of Client Solutions, Lindsay Landing is our Healthcare Compliance Consultant at Attentive, and Adam Boron, Solutions Manager at Attentive, is going to be available to help with questions at the end. So Lindsay, the webinar is all yours. Feel free to take it away when you're ready.
Great. Well, thank you, Chelsea. Hi, everyone, and thank you for joining us for our webinar, A New Perspective on the NextGen Patient Portal. We're very happy to have you all on here today as we highlight specific NextGen Healthcare Patient Portal features included in the recent 5984 update and how they can benefit your practice. We will provide an overview on the patient portal both from a patient and provider point of view to truly understand what the full patient portal experience is really like. Really, our goal is to provide you with the information you need to not only increase patient satisfaction, but also clinician satisfaction with the NextGen Patient Portal. Specifically on today's agenda, we will go over a brief introduction to the patient portal, and I mean very brief. Everyone knows what a patient portal is these days and knows about the NextGen Patient Portal. We will then highlight features we found important in the various patient portal releases, just identifying changes that truly reshape the end user experience, both from the patient and practice side. And finally, we will get into what I like to refer to as really the meat of the presentation with the patient portal modules. Here, we will cover changes included in the 5984 update, walk through each module or tab within the patient portal to understand what your patients can do, but also how things transfer over on the practice side. So this means we may be revisiting items you all are used to with the portal in order to give you a context or a foundation to cover the new enhancements. And lastly, we will quickly look at the patient portal mobile app so you're familiar with it and its functionality to be able to talk about it and advise your patient population on it. So taking a step back and looking at the importance of patient portals from an industry perspective. The first component I'll mention is compliance. First, under meaningful use, and now continuing under the Medicare MIPS program, these value-based incentive programs really were the initial reason behind portal adoption a few years ago. But the real uptick in adoption of these portals has been with the next two bullet points. Number one, patients as consumers, and number two, technology as a crucial component in the healthcare arena today. Lumping these two together a bit here, patients really are consumers now. Healthcare is being viewed as a service. You better believe patients shop around for their new providers, comparing online reviews and what each one has to offer, and the convenience of patient portals play a big role in that, as well as an increased importance of having a digital presence. Millennials expect to be able to go online and access your practice's website, and not only access it, but easily navigate it and find it helpful compared to others. These are huge trends that really show no signs of slowing down, which is why the patient portal has become an integral part in any practice's operations. Switching gears a bit from patient portals in general to NextGen's patient portal specifically, it is supported on both desktop, mobile, Android, and an iOS app. I only mention this to try and illustrate how this mindset of access to your data anywhere keeps creeping up. Patients expect to have their data at their fingertips, quite literally. But what does the NextGen Patient Portal do exactly? Well, at a high level, very basic overview, it has functionality to allow secure messaging, requesting appointments or even real-time booking of appointments, viewing your chart or requesting your PHR, viewing statements as well as paying balances on statements, renewing medications, and patient education on things like medications, having access to HealthWise and a health decision tool, as well as a symptom checker. And while these capabilities are what's expected out of a portal today, they make a huge impact. NextGen presented these stats actually at UGM this past year, so they are even larger now. But at that time, they had 16.4 million portal users, with patients logging on an average of 6 times. You can see the staggering numbers for medication renewals, appointment requests, and messages that were used, and ultimately significantly cut down on phone calls to the practice. Point being here, patients use the portal and they use it often. And most of the time, they prefer it over a phone call. So if we take a look at the NextGen Patient Portal releases, we've seen the major ones highlighted today are 2.4, which came out most recently in September of 2017, and included changes in regards to various compliance topics. 2.3 release was in October of 2016, and honestly, we won't look at this one at all since it really only contained a few new features. It mostly just resolved a ton of known issues. And then lastly, the 2.2 release, which really gave the portal new functional features that impact the end user experience in a positive way. Starting with the newest release, 2.4, we will highlight just some of the updates we won't cover specifically when we go over each module or tab within the patient portal itself. So first off, are changes made to be compliant with what's called Web Content Accessibility Guidelines. These guidelines make sure websites have certain components in place to assist patients with disabilities to navigate these sites more easily. Another new feature is the personal health record request. We will go over this one in more detail when we look at the My Chart tab, but this functionality is required under Meaningful Use Stage 3 to view, download, and transmit their health information to a third party. Along those same lines, there's a new Send CCDA option. Portal users can now send a CCDA to any email address, and it will send as a password-protected email, which we'll also look at later on. The portal now utilizes InstaMed payment, which is payment card industry or PCI compliant. This means patients can pay online statement balances. And lastly, patients can receive a copy of messages through the portal sent from provider to another provider if the center designates. So patients are included in the provider-to-provider communication about their data if the providers choose to, and we'll cover that later on as well. Now, the one feature I mentioned that we won't necessarily dive deeper into later on is this WCAG compliance enhancements. And I want to take a moment to go over these since they changed the design of the portal completely. What these changes did was to make sure the site was perceivable, operable, understandable, and robust. NextGen did this by updating the color and contrast, by introducing larger font sizes and darker colors. They updated icons and added calendar icons. They improved required field indicators, and they actually enabled keyboard navigation. So what that means is all the functions can be accessed using the keyboard. So navigating with the tab key, pressing escape to close a pop-up, or submitting information by pressing enter. Now, I get it. These might not seem like a big deal, but once you compare the old portal landing page on the left to the updated one on the right, you can see it really does make a difference. Notice the primary color change from orange to blue, as well as the larger text and more visible icons. Again, this doesn't change any workflows. It just makes sure this portal is meeting these guidelines. Just a few more examples to demonstrate here so you know what your patients are seeing. Warning messages contain different fonts and icons. There's no more rounded corners for these sections. All section icons have been updated. You can see the fonts are larger and darker. A caret displays for those that have a drop-down option now on those tabs. The options aren't new, just a caret that indicates there are options below. So that's the little down arrow symbol you see I pointed out on the Mail tab. Virtually every button, icon, menu option, and checkbox have been visually tweaked in some manner. Again, functionality hasn't changed, just the design. Jumping backwards a bit and looking at an earlier release, 2.2, while most of us are used to these changes since they've been in effect for almost 3 years now, I wanted to go over just a few major ones this release did to the login process for users since it stayed consistent through the 2.4 release. And it'll also introduce all of you to the login and enrollment process options your patients and practices have. So I mentioned before that 2.3 release really didn't do too much besides correct a ton of known issues. But the 2.2 release right before did a lot for the site and revamped it entirely. Some of the big changes were renaming the research tab to patient education, adding a new patient education search feature on the header of the website, and actually having improvements to the patient education tab itself. So including links for symptom checker or the health decision tools and medications. Labs were renamed to results, and there were improvements to the login and enrollment features, such as renaming the Enroll Now button to I am new here, and increasing the character limit for username and password fields. There were improvements to username and password recovery pages, and there were also improvements to the bulk or auto-enrollment workflow. So those last three I mentioned we will look at more closely next since they truly made the biggest end user impact. We already went over these enhancements, but you can see the button has changed to better guide users on their selection. And once they click I am new here, they have two options available to them, which will lead to different drop-down windows appearing for them to either enter a token or a temporary username and password. If you forget your username and password, you have many more options than we ever had before this 2.2 release. You can forget just your username or just your password or both combined, as well as if the practice gave you a password reset token. This makes the process of recovering your login information more straightforward and user-friendly, so you can actually direct your patients on what to actually choose and select that fits best their needs. So as I mentioned, depending on the option you select, a section will expand with the relevant fields that need to be filled in. Some require a lot more. For instance, if you forget both your username and password versus if you just forget your password, you only have to fill in one box. Now, what this segues into is the actual process of enrolling patients. After going over the last few screens, you may be asking, how do my patients log on to the NextGen Patient Portal? To access that portal, your patients must successfully complete enrollment and create an account. And you can choose one of the following methods to enroll your patients. Token-based enrollment, so you can provide the patient with a token. Username and password enrollment, so you can provide your patients with a temporary username and password. Patients can log on with these credentials and activate their portal accounts. And then patient-initiated enrollment. You can allow patients to enroll in NextGen Patient Portal by providing them with the self-enrollment link. After patients enroll, using that link, you can verify the patient details and then accept or reject the enrollment. There's also a fourth option to enroll patients that we at Itenov offer as well, and that's auto-enrollment. Auto-enrollment is a plugin that automatically enrolls a practice's patients into the NextGen Patient Portal. The purpose behind it or why we do it. The patient doesn't have to complete registration documents in the office. This can actually be done prior to their visit then. They are automatically considered enrolled, bypassing the pending stage. So information can be sent right away instead of waiting for the patient to log on for the first time. Auto-enrollment can also be used to transfer all of the non-NextGen patients that currently use another patient portal into the NextGen Patient Portal. How this works, the practice acquires patient emails through normal daily operations. A custom SQL script will pull all patients seen that day with an email address and then auto-enroll them. It then sends out an email to patients with a temporary username, password, and link to the website. This email can be customized on whatever details are included, the frequency that they're sent, as well as the username, password, general format generation. Patients are then prompted to change their username, password, and other security information upon their initial login. Now, you may have some patients who are enrolled in multiple practices. If patients see providers that use NextGen, they can enroll in the patient portal at each practice and then link them all under one account. Patients just need a token from each practice and can enroll or even unenroll under the Managed Practices tab within the portal. So the screenshots you see are the process of adding a second practice that uses NextGen by going under Managed Practices on the Settings tab. For patients enrolled in multiple practices, on the home page, under various sections, it will designate which practice that line item refers to. So I'm talking about the medications or the lab results. So on that home page, you'll see a lab result listed, and it always has the practice name as a column. So you'll be able to designate which is coming from which provider, but still being able to see all of your information in one place and getting a complete and comprehensive view of your medical data. One thing I will mention before we move on to exploring the portal in detail, as well as the new features, are the email notifications patients receive when using the portal. I mentioned they will get one to start the enrollment process, but patients will also receive an email notification in the following cases. When you receive really any correspondence from the practice, such as appointments, documents, statements, medications, even medical forms, or your personal health record. Also, when your practice locks or unlocks your accounts as well. Now, we do want to note it is important to let your patients know that they should be receiving emails in regards to their portal, because there are some spam blocking softwares used by email providers that can block legitimate emails. So make sure to relay to your patients to ensure that you're receiving these patient portal emails and to add this patient portal no reply at nextgen.com to your contact list. And then finally, what I wanted to end this section on was the updated login and homepage for the portal as of today. We went over the importance of patient portals in today's healthcare arena, as well as specific new features for the NextGen portal that affect the patient portal website, and then finally how to enroll patients. At this point, you can get your patients enrolled and logged in, where they will see these screens. Our next section, we will go ahead and delve deeper into each one of these tabs at the top of the portal landing page, as well as the added functionality from the 5984 upgrade we've included throughout. So without further ado, I will actually go ahead and pass it off to Cindy Kincaid, who really knows this portal inside and out, to take you through these modules. So Cindy, it's all yours.
All right, thank you. Okay, as we move into the modules, we're going to talk a little bit about this, and I'm going to go through this quickly because particularly areas that I think everyone on the call, and the majority of you at least have a working knowledge of. As Lindsay said, this is for a foundation of the portal itself, as well as focus on the areas that I know NextGen is providing enhancements to as they move forward in the future. So we'll be touching base on that a little bit in terms of just where their focus is going to be. I can tell you that the patient portal is one of NextGen's major development initiatives for 2018. There will be a release coming out at late spring as well as one in the fall, and at that point I will touch on areas that this will improve. As we mentioned, the web modules available through the portal today are the appointment, medications, patient education, documents, secure communications, statements, online forms, and the personal health record. First of all, we're going to talk about our appointments, and we're going to talk about those depending upon how your practice schedules and books appointment requests received from the portal, if you do this at all. This is probably one of the areas that has been slowest to be adopted by many groups, simply because of the fact that it scares people. You don't necessarily want patients being able to affect their own appointments, but I can tell you it's becoming more and more of a demand by patients as they move forward. So your two options in the portal are to submit an appointment request by selecting a preferred date and time, and then the patient can wait for a response from the practice, or the patients can actually book the appointments themselves by searching online for available appointments, schedule the date and time, and this is often called live booking. This is configurable on the basis of the practice, and we'll talk a little bit more about that as we go forward. So if you look at the patient appointments, practices can elect to allow patients to request appointments only by using the integrated function. This is in your practice setup, and you simply go in and you say the scheduling format if you enable the module, and then you say you want them to have the EPM integrated request. Once you've done that, you can actually set this up, and this will enable the icon on the patient portal itself from the patient's perspective, so they will now be able to see that they can make this request on the practice setup. On the NextGen Portal homepage, they simply would have to click Schedule, and then they click Request an Appointment. Once that's done, under the selection, they would select the medical practice, they would select the provider and group available, and then they would select the category or service type for the appointment. And again, all of these are configurable in the way you set up the portal. You do not have to make everything available. For example, you could perhaps say that I only want them to schedule a certain type of an appointment, or maybe your procedures or other things that are more difficult to schedule or require more interaction. You could not make available on there or have a note to say any other appointments, call the office. Once you've done that, you would select the office or the facility location where the patient wants to schedule the appointment, and then that would allow you to view the address of the selected location, and then you click the address link. Once the category is selected, you only are allowed to submit a request for an appointment. You can send the request with your preferred date and time from the patient's perspective. You then must wait for a response from the practice. So the patient would send the request in, but the practice would have to respond to confirm it. The patient would be required to enter the required information in the appropriate fields, and then once they've done all that, it would submit. The practice will then see it, and then once that's done, the response will be sent back to the patient. Once it's submitted, the practice will then see it in the EPM via the mailbox function. So you can see in the screenshot we have, you have your appointments, and this is an inbox of patients coming in with their request for appointment. From the practice perspective, you would then have someone assigned that would actually be monitoring these, and they would get the request for the appointment. They would double click on the request in the mailbox, and it would be routed to the schedule using the criteria entered for the patient. This actually brings up the standard following schedule functionality, and the operator would simply follow through and take everything and schedule the appointment. It would do the search of the times. You pick the appointment that you think would best meet the patient's needs based on the criteria they put in. And once saved, the appointment is booked, and then a response is sent to the patient. And the nice thing about this is this all active through the portal. There is also a note made in the patient's chart. And as we mentioned earlier in the presentation, once that's done and it's sent back to the patient is then notified via an email that the appointment has been booked. So they would receive a response such as this, that you could actually have your logos on and everything. This is a very generic response we put in here. And all you would have to do then is click on it, and the patient would then click on it and be able to see the appointment. So once they've clicked, it will log them into the portal to review their messages, and they can see that this appointment is here. And then they could go through and they could accept the pending appointment. So when the patient sends an appointment request, the practice can book the appointment or reply with an available schedule. If you didn't want to book it, maybe you didn't have something or something had been filled, you could also reply with an alternative option, and you can go back and forth on that. The pending appointment request appears in the inbox when the practice replies the appointment request with a scheduled time. Once the patient receives a pending appointment request from the practice, they must accept the request to schedule the appointment. They do this by opening the pending appointment from the inbox and click Accept. That then would send a message back to the practice. The patient also has an option to cancel a pending appointment request. Now, we'll talk about canceling appointments later, but this is only an appointment request that we're talking about at this point. So let's say they sent in a request, they hadn't heard back, that was no longer valid, they decided to call, any number of reasons. The patient could then go in from the mailbox, click Sent Items, and open the pending appointment, and then click Recall Appointment Request, and that would pull it back. Patients can send a reply to a pending appointment request if required. So let's just say there was a reason they needed to have further communication. So from the mail, click the Sent Items and open the pending appointment, and then you can click Reply, and in the reason for new appointment, enter the reason to change the appointment or make any changes that you were making to this request. And once again, we are talking about a request. A message notifies that your patient appointment reply has been successfully submitted. So all of this is coming from the patient's perspective, and this way they can communicate back and forth, because as we know, when you make a request, sometimes you want to change that request. So we have the option to recall, and we have the option to also reply to it. Now, what has been slower to be adopted but is also becoming increasingly popular, and I can say the groups that are doing this, either using this service or other services, we've done some webinars on this, is actually allowing the patient to book an appointment. This is also an area that NextGen is focusing on heavily for some of the next 2 updates. It'll be done in 2 phases to expand the capability of allowing patients to self-schedule. It's referred to as live booking in the system. I refer to it as self-scheduling. As we all know, patients really want to be able to control their lives. They want to schedule things from their hair appointments to schedule their food online to now scheduling their groceries. This is becoming more and more an environment where people want to be able to control what they're booking and when. So based on your practice's portal preferences, patients can actually book appointment online today. They can create an appointment request, and under the search appointment, enter the required information. So what will happen here is that depending upon your templates, and there is setup and configuration for this, but what will happen here is if you've got this enabled, the patient can then search for the appointment based on the criteria, and it will tell you, it will come up and they can actually book their appointment and send the request back, and it will update the schedule using the communication services through NextGen. We did want to note that if there are no appointments available for the date and time that the patient selected, you can enter a separate date or a different time and submit the request again, and it will go on in a circular fashion until they find something. So if we go through the process of booking a live booking, enter the reason for the appointment. From the priority, select the level of urgency. If you are considering using this, you do want to make sure that you are functioning in a capacity that the appointments that you have here that allow self-scheduling are something you can control. So the urgency is something that you can put in, but you want, again, this is something I would work with your patients on. From the make appointment, from make appointment for, select a time frame for the appointment. The patient would then select the start date and end date when they would like to schedule the appointment. They would select a time within the hours of operation and then select a corresponding checkbox for the day that they would like to schedule the appointment. So all of this is filled out before they have done the search. Keep in mind, it's going to go out and look at templates that you have created. So you do ultimately control, even though here they may be looking for everything. The areas here that are really important are the reason for appointment at this stage. Otherwise, it's looking for their preferred dates and times. We also put some sample messages in here, such as attention, do not schedule procedures such as colonoscopy, ultrasounds, or IUD insertions. This is something you'll want to also work on as you're setting this up and piloting it. Once you've put in all the information and you've hit the search, you could have available appointments, and then if you want to load more available appointments, the patient could just simply click load more. They can also go back, and they could go back to first available, and then once they've made their decision, they select the appointment and click the book appointment icon. Now, it's as simple as that. That's really all there is to it. The really hard part is in the setup and the configuration, and we can talk more about that in a different session or in training, or if you're working to set it up, and we can look at experiences of other practices. We won't get into that level today. But once the patient has booked appointment, and if they have booked the appointment during their portal, they can actually reschedule a booked appointment from the appointment date. So how they would do this is from schedule, they would click my appointments and then open a booked appointment. And all they have to do is simply click reschedule the appointment in the upcoming appointment section for the home page dashboard. Once this is done, you can select a reason and then submit, and the selected appointment status is set to cancel. Now, they are rescheduling, but what would happen is even though it says reschedule, it is actually canceling it, and then it will start a new appointment request. So that's something we kind of, is a little bit verbiage, is a little tricky for some patients, that we want to make sure that that's something you're aware of when you're taking your pilots through this, because I would recommend, if you're going to do this, you have a pilot program and work with some select patients on making sure it works in your environment. We did have a note that I want to go back to. The reschedule this appointment link is not available when reasons to reschedule are not set up by the practice. Contact the practice to reschedule the appointment would be what it was said. So if you don't want them to do this, don't set it up. You could actually set them up to schedule, but not allow them to reschedule, or as we move forward, not allow them to cancel, because we'll be covering that next. So if they want to cancel a booked appointment, that is also an option in NextGen that they have added over the course of time. And if needed, patients can cancel an appointment that was booked using their NextGen Portal account. It's only portal booked appointments. They can't go in and cancel other appointments that are there, at least not yet. From the Schedule tab, you can click on My Appointments, which would display other appointments, so I want to be really careful that you can also go in and just look at your appointments. But from the Schedule tab, you can click My Appointments and then open a booked appointment and click Cancel this appointment. From the Reason list, select a reason and then click Submit. The selected appointment status is then set to canceled. You can also click Cancel for the appointment in the Upcoming Appointments section in the Home Dashboard page. So I wanted to clarify what I said. You can only cancel from certain areas if you booked it through the portal, but if you have other appointments, you can actually look at the Home Dashboard and they can cancel those appointments as well. As I mentioned earlier, this appointment link will not be available when reasons to cancel are not set up at the practice. You can have the verbiage contact the practice to cancel the appointment. This is the most common in terms of not wanting people to cancel appointments because you'd like to control that it's rescheduled perhaps. So a lot of practices haven't embarked on allowing patients to cancel appointments just yet. So some of the benefits to patient appointments. The patient appointment has been scheduled and notified without a single phone call. In both cases, you're cutting down on your phone traffic. Less time was spent on the part of the practice and the patient. There was no time spent on hold. The request was not limited to only practice hours, as the patients could work on this at their own time and convenience. And the entire transaction had the history at the patient level and at the practice level, eliminating questions or confusion about who said this or who did what, or I didn't really want to do this. The one risk that we have encountered with live booking appointments is that you still have patient behavior. So you may set up a specific type of appointment, such as an annual visit or a preschool physical, or something that doesn't require a lot of practice interaction, or that you have a very specific template for. Well, if the patient wants to get in and it's not quite working for them, and maybe they didn't want to spend time on hold, there's nothing can stop a patient from behaving badly and actually scheduling an appointment in a slot that's designated for something low risk with something high risk. This is really just a matter of making sure your patients understand the importance of following the guidelines. That's going to apply with anything you have a patient doing, though. You can only encourage proper behavior. So as we move on to the next module, this would be medications. So the medications prescribed at the practice display in your patient portal account. So if you've had a prescription that you've given to a patient, they will now be able to see this when they're online in the medications module. The medications section on the home page lists all medications. For medication renewals, which is an option from this, the patient can request a medication renewal via the portal, as well as add or change their pharmacy. Now, this is a functionality that has improved over time. They used to be able to add a pharmacy, but it didn't update. That has actually been improved and changed. So in order to request a medication renewal, the patient would select Renew Medication, and from the NextGen Patient Portal homepage, they would simply click Medications and click Refill. On renewals, they would have the option to renew medications. So on the Renew Medications form, under Select Your Practice, under Renew Medications form, under Select Your Medical Practice, you can perform the following tasks. You select the practice. You select any one of the following options for a patient: self to request medication on your own behalf, or dependent name to request a medication renewal on behalf of a dependent. So this is just taking you through the process of renewing. Then under Select Medication, a list of medications available for renewal appear. Now this is a little bit different than requesting a medication. This is one that's already being taken and renew. They're pretty much the same, so it's just a matter of kind of understanding different functionality and how you're configuring this. You can either go in and pick up medication to renew, or to view inactive medications, the patient can select and display any inactive medications that may be available for renewal. So if it's inactivated, it would drop off and you would have to actually pick that. The patient can then select medication that they want to renew, and then they can select inactive medications. And if it's inactive, they would simply state yes, and it would be the above inactive medication. So if the patient is selecting yes, I would like to renew the above inactive medication, a warning message will appear, and then you click Submit, or the patient will click Submit. So you can see that it indicates an inactive medication due to it being expired. And this is where the end date of the medication is prior to today's date. So that's just on the warning that comes up for the patient. Once you've made those selections as a patient, you would select the pharmacy, And if no pharmacy is selected, or if you want to select a different pharmacy, the patient would simply select that. The user can then either search for one or add a new one. Once the pharmacy is selected, the patient has the option to set it as their NextGen Patient Portal preferred pharmacy. Once it's been set up and submitted, the patient has to select a reason for renewal, select the provider to whom they're sending the medication renewal, and if there are any comments, they can enter the comments and submit it for the prescription renewal. Now, from the practice perspective, once a renewal request is received, it shows up in the workflow inbox. The provider opens the request as well as the chart and is taken directly to the medication module so that they can manage the request. So again, saving some keystrokes, because once they open this, it will take them directly to the module, and then you'll kind of see the process. And what will happen is you just follow the steps, and once it's been approved and the patient it's been submitted, it will then send the notification back to the patient via the email that we've seen before, and the patient will then go in, link, and they can indicate that they need that the medication has been renewed. I want to point out that when you get these renewals, it will tell you you've received a response. It doesn't actually tell you the details. Now, you can make an assumption, but because of privacy requirements and some of the other things with email and secure communications, you must go to the portal to actually see what was happened, but it would tell you that there was a renewal response from a patient perspective. So some of these benefits are the patient requested refill without a single phone call. The patient was able to communicate outside of normal hours. The provider managed the request in his or her time frame. No return call was needed. The refill was documented in the medication module, as it would have been if you'd done it manually, and it was forwarded to the pharmacy. And the patient was able to add or update the pharmacy information. Another area that we have seen more activity on recently is patient education. Now, this was added when they had some of the updates that what Lindsay started in the earlier area, because it made it easier. So now patients, very much like you can when you go to WebMD or some of the areas, can get some of their own patient education material if you have the HealthWise options enabled. So patients can get health education material from the Patient Education tab. The tab provides with access to HealthWise Health Knowledge Database, which is an online health encyclopedia. They can access educational materials on a variety of patient educational topics, symptoms checkers, medications, and health decision tools. Some groups like this, some groups don't, and it's just letting you know that it is available. As the patient would basically take a look at this, they would click Patient Education, and then they have the option to search health topics, access interactive tools, view health topics, and access learning health centers. And this is just a sample of the screens that the patient would see. So you can see at the top, we have the patient education, and these are the drop down which it gives them options that they can go into, and they can look up information. They can use a symptom checker that takes you through a series of questionnaires. You can access the health decision tools to make smart decisions in terms of knowing your options and everything. These are all standard templates that are coming from HealthWise. And then, basically read about your medication. So it's basically looking through all of the options and allow the patient to do some of their own research. And again, I want to emphasize some practices really like this. Others prefer that patients do not try to self-diagnose, which sometimes these types of tools lead to. Just keep in mind that they all have this option while they can go out and Google anything that they're looking for. And this at least gives them an area to do it within your practice and looks like a tool that the patient is being provided from the practice. So new from patient education and the patient portal, this is an area. Another way patients have access to health education is if their provider sends it to the patient portal. So you now have capabilities to be able to send more information coming from the internal patient education functionality that was expanded in 5984 to where the provider can bring it up and actually send it to the portal. They can also have the ability to look at multiple patient education forms, and this functionality actually counts for patient education and secure messaging under MIPS. So this is something that was added in 5984 and actually enhances the capabilities of communicating with your patient on educational benefits through the portal. Now we're going to move on to secure messaging. This is another area that people have either really loved or really not embraced at the practices. So this is giving the providers the ability to accept messages and patients the ability to send messages to the providers from the portal. And so it allows you to receive messages from the patient, send messages to the patient, and reply on both directions. Using the secure messaging, patients can also request and receive documents. So we're going to focus on the documents from the webinar. So if there's a case, the patient requests a document be forwarded by the practice by composing a message and filling in the appropriate practice category, provider, and the subject. Now you'll notice the category is medical. We have here medical questions. This is a very simple scenario where maybe you just want to put up medical questions. Maybe you want to have 3 or 4 categories. This is really as simple as that in terms of setting it up and categorizing the types of messages. So in this case, once they've done that, the practice would then receive the request, and then they can open the patient chart, locate the document, and simply attach it. That's just an example of how you can send documents. You also now have expanded capabilities throughout the application to be able to forward other types of documents to the patient from the portal that's initiated by the practice. So we can talk a little bit more about that as we move forward. Once the document has been sent, you'll see that we receive this typical notification. The patient logs into the portal to review the document and any other messages from the practice, and this just gives you an example of how it might look from the patient's perspective. From the practice view, the practice now has the ability to not only know that the patient was sent, but it also lets you know that it was opened. So in a lot of areas, you can have a return message and let that know, and I think everyone knows about that in the portal. But this also has the ability to document that the patient actually opened the document, and that would be in the chart. So there's 2 levels of this. So you can see the top level shows that the patient did in fact open it, and then you can also say that you want a notification so that you can modify and understand if the patient just ignores what you have sent. So this is really useful when you're being the initiator as opposed to the patient initiated request. So what are the benefits? I think we're going to cover the same things. You were able to communicate without phone calls. You were able to do this outside of normal hours on both sides. The practice provider responded without the need for internal communication, so we didn't need to have a lot of tasking. And if you are monitoring, if you have a setup where someone else is monitoring the messages coming into the provider, which some of our groups do, then the provider never needed to be involved in certain cases, which might also help. There was no paper or postage required from the times that when you're mailing these things, and the correspondence was fully tracked. We'll talk a little bit about patient questions, and it's along the same lines and in the same area. You can now send a question. You can allow the patients to send a question to the provider or to the practice, because these can be monitored by someone other than the physician themselves. And what will happen then is that basically the clinical staff or the provider, depending upon your workflow, will receive a request that they will receive a request that the provider has the message, and then you can either respond on behalf of the provider or the provider can send that. And depending upon how your profiles, you can set these up to not reply. You can do a lot of things. So there's a lot of opportunities for using these messages and using the message routing rules that we'll talk a little bit about in terms of when you set and configure this up. So a lot of capabilities associated with this if this is something you need to use. This is very different than when it started out initially, that it was just back and forth questions. They've expanded this a little over time. You can utilize things with reports. So there's a lot of things you can do with these secure communications, patient questions, and then also responses. Now, new, we talked a little bit about the provider patient portal messaging. So the category column, a new column called category was added to the inbox for the 5984 upgrade. So for every patient-initiated message, it displays the message category selected by the patient while composing the message. So this makes it easier to monitor, particularly if you are trying to segregate the priorities of these messages, who's going to be responding, etc. So this is just another functionality that's allowed you to better manage these messages if you are utilizing this particular functionality. Another feature of secure communication with the patient is it is fully documented. So whenever a patient sends in a patient question, it's important to note that an encounter is created and it states that it was a patient portal email. So you will actually have the patient portal email listed in the patient's chart, so it's fully documented. And yes, phone calls can be documented, but you are requiring a manual intervention. And when the response is created and sent back and forth, all of those are attended to the particular documentation in the patient's chart. So again, very, very easily enabling documentation between patient communications and avoiding those phone calls. Once the response has been made, we have the same process. The patient is notified via the email. The patient accesses the portal to receive their response, and then they can communicate back and forth if additional communication is necessary. And once again, new provider patient portal messaging. In 5984, there is a new contains clinical information checkbox in the compose reply window. So when a provider is replying to a message that was received as a medical question, they need to check this box in order for it to count as a numerator for the ACI MU measure credit. It is checked by default in the EHR, so they wouldn't have to worry about it. However, it is not checked by default in PM. And I think that's largely due to who would be responding. If it's in the EHR, it's more than likely that a provider or someone communicating the patient would be responding. And in PM, it's likely something that you would want to control by enforcing a check. Regardless, this is new functionality, and it does actually account for the ACI MU measure credit. So, what are the benefits for secure communication patient questions? They're pretty much the same as any of these modules. If you can get these functional, you can talk to the patient, communicate without phone calls. You are able to work on their time as well as your time, making it more convenient. And there's no return calls, and the question was documented in its own encounter in the patient's chart. Now we're going to move on to statements, and this is probably one of the more popular functionalities with the portal, which has also improved over several iterations of the upgrades. It's also an area that is going to improve further in some of the planned updates. So patients and practices can opt to receive electronic statements that can be accessed from the patient portal. In order to do this, it would allow the patient to view statements online, and it'll also allow them to pay with credit cards online, provided you are participating in some of the supported services. I won't get into the different services on this webinar, but there are several services that will allow you to do this that are the typical ones that NextGen has when you're doing online payments, even with a credit card swipe or something of that nature. So same services that NextGen supports throughout its application. Once you set this up, the users have the opportunity to see their last statement, the last statement history, online payment, so they can view online payment details, and then they can make payments from the statement homepage that showing the account balance, or view the statement page. And then they have the opportunity for a real-time account balance. If your practice has opted, the real-time account balance allows you to receive your updated statement whenever you make a payment. So this is something you can turn on in functionality. This will allow you to make multiple partial payments if it's required from a patient's perspective. So just an example of the screens, to view statements on the NextGen Patient homepage, the patient would click Statement. They would click View Last Statement. Then they would open up and they would see that the statement is following options. If they are enrolled to more than one practice, they would select the relevant practice. If it's only their practice, they wouldn't have to make that decision. If the person accepting it is a care manager, they would select the patient's name. And if they wanted to view a statement for a specific date, they would select the date. So you would actually see a list. Once you've made all the selections, you would click View Statement. After you view the statement, you could return to the patient stage and click to return to the balances link, and then the patient would be able to click Print Statement. If the practice has enabled online payment feature, the patient can make payments through the NextGen Patient Portal for the statements they have received. Refunds are not issued on the patient portal, so if there are refunds, that's not an option. Patients would then click Statement from the home page and select Pay Now. Patients can then pay by credit card or e-check depending on practice rules. And new with version 2.4, InstaMed Payment Gateway as payment card industry PCI compliant has been incorporated. We want to make a note that based on your practice configuration, you can make which transfers or Instamed. So those are two of the options, and I believe there's one more. Once the statements have been selected and the patient's payment has been processed, they can receive a notification via email that their payment was delivered. They will also be able to print a copy of their receipt as well as view a copy in their sent folder. It is important to note that this may take 24 to 48 hours. The benefits to statements, I think, are pretty obvious. The patient was able to view their bill via the portal without calling. So if they lost that statement, they can't find it, they just want to check and take a look, they will be able to do that. The patient was able to pay their bill via the portal. The patient was able to communicate outside of normal hours if required. No phone call was needed, and the payment was tracked and receipt was stored in the patient's sent folder. So now we're going to move on to online forms, and I'm going to hand this over to Lindsay to take this through the end of the presentation. So Lindsay, it's all yours.
Great, thank you, Cindy. Again, I'm just really hopping in here to give Cindy a breather. It's a lot of information to take in. I know we're running a little bit short on time, so we will be sending out the slides to you guys. But I really wanted to focus on online forms and the personal health record, our last two real modules that we're going to go through today, because they do have some new functionality. So practices actually have the ability to create and forward intake forms to new patients, as well as for predefined patient types. You can forward your desired form set easily from the patient's chart just by following the steps in this screenshot. So the practice selects the form set, and it'll be sent to the patient, and they're notified via email, which we've been seeing throughout the presentation. So the patient just connects to the portal using that link in the email and begins the completion of the forms that are just waiting for them in their portal. So the process is very straightforward. It's user-friendly for the patient, both from a notification and an access standpoint. Multiple forms are included in a set, and they're completed in order. So you have the ability to customize and even create your own forms as well to include. But with these standardized examples, you can see the demographics, the past and social medical history, et cetera, can all be collected before the patient has even entered the office. And then after the forms are completed by the patient and saved, they are automatically returned to the practice and removed from the patient's inbox. So they aren't just going to be sitting in the patient's inbox at all either. They are removed. What we've been seeing here again is with the seamless integration, completed forms are now placed in the provider's inbox, and they are displayed in the message, and at that time they can either be accepted and imported or rejected by the provider. If they are accepted, they're saved as a new encounter in the patient's chart. And then the form is actually displayed in the chart exactly as it was created. In addition, the appropriate fields in the appropriate templates are updated. So this is a huge positive from a time-saving perspective. All of this data was completed, imported, and integrated into their chart before the patient even stepped in the door, saving everyone time and eliminating paper in the process as well as data entry. Something new with the 5.9 release, you can actually run a crystal report that lists how many online form requests were sent through the NextGen Patient Portal for a specific date range. So that report name is going to be 5.9 PP Online Forms. And to run the report, you must specify the date range as well as the status codes, et cetera, which you can see you would enter all those values in the screenshot. The difference I do want to point out between the summary and detail mode is pretty self-explanatory. One's more detailed than the other, but the detail report actually includes everything on a summary report. So we'll look at that right now. So after all the fields are entered, it'll run and display with the detail at the top and the summary data at the bottom. So the summary data is just that table you see at the bottom, whereas the detailed data is everything above it. So the detailed data is categorized by status. So you can see that first section is online form sent, and the second is received or pending processing, with patient-specific data listed below each section title. You can see in that blue table all the different categories that could display. The other ones include things like online forms imported or forms rejected. Looking kind of closer here at the detailed report, this is a breakdown of the information you can see under each status. All statuses are going to show you basic information here, like patient name and person number, dates, who it was sent by, etc. After those, it depends on the status. So for example, if the status was forms were imported, it says by who and the date and time. Or if the forms have not been returned, we can see if the patient has even viewed them yet. So overall, a very helpful report if your practice is using online forms through the portal that is brand new with 5984. Again, with the benefits here, the main one that I would say is that the practice imported the forms, eliminating data entry at registration or check-in. So going ahead now and looking at the personal health record or PHR feature offered through the portal, since there have been some updates with the new 5984 release and the 2.4 release. So essentially patients enrolled in the portal have the opportunity to view, download, and send their personal health record. They can request the document without any staff involvement as well. So practices that have PHR set up to automatically send out when a patient has completed enrollment, as well as when each office visit encounter locks. And that encounter lock time frame is 7 days, but it can be customized. Patients can also manually request their PHR. So again, you just go under My Chart, where you can either view My Chart or request your health record. When it comes time to actually request your personal health record, you'll just need to know which practice you're requesting from, and then you have a bunch of different options here for your chart date. So you can see you can do your last 30 days, your whole previous year, or just this year, or even customize that to be a certain from and to date, and then just click Submit. The patient's notified just like it is for any other correspondence that goes through the portal. They would follow that link, and then once that record's available, they have some navigation bar on the left-hand side that shows you what really is included in this record. And then there are also links to send, download, and track who has viewed the patient's chart in the upper right-hand corner we'll look at. So like I said, the personal health record components here, it's pretty comprehensive. Just some things to point out. For lab results, it's only going to show signed off labs, and provider comments from the PAQ are not going to be included. And then for plan of care, it does include any care guidelines and labs that were ordered but not yet resulted. A cool feature here is that patients can view an activity log for who's actually accessed their patient portal. One thing that I do want to note here is that this is for more or less authorized users on your patient portal account. This is not for practice activity. So if you are dependent and your parents have access to your account, or vice versa, if you have access to your dependent's patient portal account, these are the logins and activities that will be tracked in here, not actually what the practice is doing. And then you can also have the ability to send your PHR. So patients can actually have a few options here. You can search for provider and send the PHR like normal. What was new with the 2.2 release was that patients can actually send their PHR to a provider using their direct address. And if everyone's familiar on the phone with NextGen Share, providers have direct addresses. So you may have patients calling your office asking for your provider's direct addresses, and those are different than their email addresses. And then what's new with the 2.4 release is that you can actually send the PHR to a third party using their email addresses. So again, what we're looking at here is when we press that Send My Chart, we're looking at this second screenshot here with all these different options. These are what have been expanded throughout the releases. So new with the Patient Portal 2.4 is this ability for a patient to actually send their PHR to a third party, and that includes private email addresses. So you can actually send these to someone with an @Gmail account or an @yahoo.com, etc. Now, don't worry, the chart is sent as a password-protected zip file, so when the recipient tries to open the attachment, they're going to be prompted to enter their password. Ideally, the patient should verbally call the recipient and shouldn't be sending it in the body of the message to make sure that it is being sent securely. Another new feature here is on the practice side or provider side is the added CC the patient option when sending a CCDA. NextGen Share can send a copy of the CCDA to a patient's patient portal account while they're sending it to another provider using NextGen Share. So again, this is a benefit here. By doing this, you're not only going to increment your HIE measure, but also your secure messaging objective on their MIPS, which a lot of providers were having trouble incorporating into their workflow this year. So from the patient view, what it would look like if you're concerned about it, it does show up saying that you have been copied on this, and it is a no reply message if you were looking to use that. So again, the benefits here are pretty obvious. It's really the patient has access to their chart at their convenience, and it really does increase patient involvement in care, which is a big goal, especially moving forward with these value-based care programs, is to increase patient engagement. So just some overall benefits I think that we've seen firsthand from our clients who really engage and use the portal to its fullest can be summed up really in one theme here, and that's making your practice run more efficiently by reducing those non-value add activities or resources and honing in on how you can improve your practice by using these value add functions through the portal. So I know we are over here a bit on time. So this patient portal mobile app section, we're going to go ahead and skip right to questions. We will include them when we send out the recording of the presentation as well as the slides, so you'll have access to them. But what it really did was just walk you guys through the portal app so you were able to recognize what your patients are seeing and be able to talk to them through that, as well as highlight certain functionality, such as being able to send your PHR through the portal app as well as see your appointments and actually book your appointments through the app as well. Again, following that theme of having the data at your fingertips and actually having this being mobile for your patients. So if we want to go ahead, Chelsea, I will actually turn it over to you for questions. I know we're a bit over time here, but in case anyone was wondering what your next steps should be before we get questions, we can let iTenv help. All of this information is a lot. If you're uncertain where your practice stands, we can help you, not only related to the portal, but to so many other areas of your practice. So if you're interested and you want to learn more, please visit us at itenv.com, sign up for our informative webinars, follow our blog, consider our 3-day fixed price on-site consultations, or even test drive our products. So Chelsea, it is all yours for questions.
Great. Thank you so much, Lindsay, and thank you, Cindy. And again, we do also have Adam on to help with questions as well. I see that he's been answering a number of questions to people directly who have typed them in, but we're going to go over them. And if you have questions, we'll stay on as long as you do to answer these. And so just type in the questions area of the webinar control panel, and we'll just go through them. First question: patient-initiated enrollment and auto-enrollment. How can we ensure HIPAA compliance? What is the recommended verification process, and what is the enrollment method that has shown the highest patient satisfaction?
Oh yeah, I can go ahead and take this one. This is Adam. So yeah, we definitely understand that there are different ways that you can enroll patients. Some definitely, I understand that some of them have concerns, especially if you do auto-enrollment, but that is a very good option. That one, in our experience, has been shown to have the highest patient involvement and satisfaction, because typically if you have that set up, it's a lot of our clients that we've done it with, by the time the patient checks in, sees the doc, leaves, a lot of times they might even already be enrolled at that point, just depending on when we have the script running. NextGen Patient Portal is fully HIPAA compliant, so you don't have to worry in that regards, but as far as if you are looking for probably the most security on setting someone up, that would probably be the token-based enrollment, just because without that token that the practice generates, the patient would not be able to enroll if they don't have it, if they lost it, and then the practice can change what that token is at any point from EHR or practice management and update the patient.
I would also like to add that in the auto-enrollment, you as the practice get to make some choices. So you can make it very secure. So you can have an algorithm like that their temporary login or their password is like the first 3 letters of their last name and the first 4 letters their birth date, or you can incorporate some things. Social Security is not a good one because most people aren't collecting them anymore, but you can pull fields out that we can utilize as things that only the patient can see. So, you know, a different case could be made that you could have lose a token. The other thing I want to emphasize is that this is another area NextGen is planning very, very strongly to modify in the next upcoming releases, and we talked a little bit about patient self-scheduling. So I would envision that the token's going to go away at some point, and probably the need for auto-enrollment as well. But at this point, I don't know when those releases are going to be out exactly, but I know that this is a real area of you know, irritation, frankly, that people have said compared to other product portals. I think we all know that on the call. So they are looking to improve and enhance.
Great, thank you, Cindy. Sorry, thank you, Cindy, and thank you, Adam. Next question. Is the script that auto-enrolls new patients in the portal a NextGen script, or is that a script that must be purchased from iTenv? Cindy, do you want to take that?
Yes, I'll take that really quickly. What we've been referring to as the script is an iTenv script. Some of you, depending upon your technical expertise, may be able to do this yourselves. We do offer this for purchase because we can modify it based on, what your preferences are as far as patient minors. How are you registering them? Are you registering them when they're 18? What happens when they turn 12? So there's a lot of rules associated with that. Do you want to register them one at a time and queue it up, as Adam mentioned, or do you want them all to go out in the evening? So there's a lot of decisions and questions you have to make. What password do you want? What is the algorithm for their usernames, etc. So all of those things we can automate and customize for each practice, and we've sold quite a few of these. However, it uses the NextGen bulk tool, so I want to be fair about that. So the NextGen bulk tool is there. So if you have the expertise to create these scripts, NextGen, the tool is included. So the bulk enrollment tool is included. It's just how do you get the patients to the tool that you have to figure it out, and that's what the auto-enrollment scripts do. And
Great,
if any of you are interested, we can chat about that. I can have someone call you back. You just let us know.
Perfect. Thanks, Cindy. Next question. Will all the functionalities discussed be met in MIPS ACI measures? Lindsay?
I can grab that one. So when we're talking about all of the functionalities discussed, a lot of these that we had mentioned revolving around patient education and secure messaging, even with the sending the CCDAs with the health information exchange measure under MIPS, the ACI category. A lot of the functionalities we discussed, yes, will actually allow you to meet those measures and increment those numerators. To actually go through specifically which functionalities we were referring to, we would need to kind of chat separately here, and we can do that if you wanted to reach out to me about that. But most of these here, yes, they do pull into the HQM and will increment your numerator.
Great, thank you, Lindsay. Next question. I understand that in stage 3 of meaningful use, encounter-related information will need to be available to patients within 48 hours of their visits. Since patient data uploads to Patient Portal on encounter lock, does that mean that organizations or practices will need to change encounter lock times to 48 hours to comply with this requirement?
I can grab that one too as well. So the information does need to be made available to them. As we mentioned, the encounter lock time frame period is customizable, so that is one way to look at that and making that data available. There are other ways as well that we can look at.
Perfect. So if you have further information or further questions on that, Lindsay's email is up on the screen. It's llanning@itenv.com. Feel free to reach out to Lindsay on that. Next question. Can we designate a patient to attach to a specific location for when scheduling appointments when the practice has multiple locations? We are concerned that if a patient schedules their own appointment, they may try to choose the wrong provider for their location. So we'd like to be able to secure each patient with their provider's location.
I'll take that. Oh, well, go ahead, Adam. You go ahead.
Okay, I was just gonna say you can limit what shows in regards to like the provider and what location that they show up in. To my knowledge, you can't restrict a specific patient to that location unless you have something else, Cindy.
There's no, and I was going to answer no, because if you think about NextGen and you think about patients are not really tied to a location. Their encounters are tied to a location. You can have defaults when they check in, or it can default from this appointment that's already scheduled. But if you think about that standalone patient chart, it's not really tied to a location when you have multiple locations. So I don't see that happening anytime in the near future, just based on the way NextGen is set up, but you can definitely not do it today.
Okay, thank you both. Next question. Can online forms be held and imported into the patient's initial appointment encounter so that the information collected populates onto the master document?
And I could take that one as well. So yeah, those online forms, if you have them set up and the patient submits them through the portal, it does go into it goes into the inbox, and those can sit in the inbox until you actually want to process them and review them and accept or decline them. When you do that, it actually will document that information directly in the templates as long as it's set up properly. And then anything that goes to the templates would then go into the document as long as you have those fields put into the document.
Great, thanks, Adam. And it looks like this might be the last question, but if you're still in the middle of typing, we'll be on for another minute here. Does the rescheduling functionality mark the appointment in PM as rescheduled as rescheduled appointment, or does it treat the rescheduled appointment as a new appointment? Adam?
Yes, I can take that one also. Yeah, so if you do reschedule an appointment from the portal, it would mark it as canceled, and then it would book a new appointment with whatever date and time the patient selects.
So it would be canceled and then new rather than rescheduled. Perfect.
Right.
Okay, well, thank you everybody for joining us today. Lindsay, Cindy, Adam, thank you all for contributing to this webinar. And if you see everybody's information up on the screen, feel free to reach out to us if you have further questions. We'll be happy to answer them in any way that you can get a hold of us. And again, I'll be sending out an email with a link to the slides and recording within the next week. You can always reply back to that with questions as well. And thanks again, and have a great day.
Thank you.
Thank you.